Ebola does not spread from someone who's not infectious. It does not spread from someone who doesn't have fever and other symptoms. So it's only someone who's sick with Ebola who can spread the disease.
Where once we were told not to panic, it is becoming increasingly difficult to not at the very least hold a tinge of it in the back of our minds when it comes to Ebola. And we are now faced with some difficult ethical questions in order to not only treat, but aggressively seek to eradicate it as fast as we humanely can. Welcome to Midpoint, the Director of the Division of Medical Ethics at the NYU Langone Medical Center, Arthur Caplan, and Senior Fellow, London Center for Policy Research, Betsy McCaughey. Thank you both for joining us today.
Thanks for having us.
Arthur, I'm going to begin with you on this one here. Is it not time for us to do absolutely everything? And I realize it takes time to find medications and to get drugs ready, but to do anything and everything possible right now in trying to stop this virus.
I agree it is, and I've argued that we should be doing much more aggressive screening at airports and harbors to see where people have been, to see if somebody might be sick on a plane. It's tough to shut down air travel completely from affected areas. The person who got to Texas came a long way around, but we should be screening much more. We're in a situation, too, where I think every American should know what to do if someone who's been in an area where there is Ebola becomes sick. Do you call 911? Do you call emergency services? Do you bring them to any hospital? Do you bring them to a special hospital? We need that advice. And I think it's important, too, as we look at this situation, to understand we've got to push the government to start spending a bit more money stopping the epidemic over in Africa, because that's where the threat is, and tamping it down there helps us. And it's important to start thinking about the policies we'll use if we get new drugs or new vaccines, maybe not 100% safety tested, but maybe we want to be ready to say, yep, we're going to activate those and use those in an emergency.
Okay, that's right where I wanted to go here, those that are not 100% safety tested. Betsy, the United States government is going to push forward here. The feds want more ZMapp, but then again, they can't make enough of this. This is the drug we've been hearing about now for about a month. They can't make enough of this in time, realizing that it is dangerous. But when you've got something that seems to be so out of control like this, try anything. Obviously, you're going to do something. Something may happen to somebody in a testing procedure, but you've got to do something, right?
I so agree with that. But let's get back to the more fundamental issue. Tom Frieden, head of the CDC, has ardently defended unrestricted travel from West Africa, the affected countries, to the United States. And the fact is, this is a real danger. He says that it's because if we restrict travel, it will cripple the economies and the recovery efforts in those countries. And that's probably true. But he also has an obligation to look out for America. And the fact is, our hospitals are not ready for Ebola.
Why are they not ready, Betsy? This is supposed to be the best medical system in the world right here in America. We have the CDC telling us what to do and telling the doctors and the nurses what to do. So why aren't we ready?
No. Let me make it clear. Many hospitals in this country lack the infection control rigor to deal with Ebola. After all, in these very same hospitals, MRSA, C. diff, VRE, and many other infections are raging through those hospitals, killing, according to the CDC, 75,000 patients a year. Hospitals that can't stop the spread of these common infections are not going to be able to contain Ebola. And that's exactly what you saw in Dallas. A hospital, Texas Presbyterian, failing the first test, which was to identify someone seeking care in the emergency room who had been in Africa and could be carrying Ebola.
Okay, let me stop it there for a second. Let me come to you now, Arthur, on this. Are we now seeing an expose on what is the real problem in the American medical system and at hospitals now? Because as Betsy points out, if we can't stop these other diseases and now we have this coming in, a nurse apparently is the one who missed this. They didn't follow guidelines and tell people that this was a man from Liberia. This is a bigger problem than just one disease, and this now has to make everybody concerned about their health care and what we're doing in order to stop infectious disease.
Well, I think we do have a problem with all infectious diseases. I think Betsy's right about that. The system hasn't done what it should be doing to institute even simple things like hand washing in the hospital.
Why? Why not, though, Arthur? Come on, these are simple things that people should understand. So why are we still here?
I don't think we're incentivizing them. I don't think we're putting the money where the quality control is. But let me come back to something else just on that travel
Okay,
issue.
I got about 2
There's a
minutes. Go ahead.
compromise. I think there's a compromise position here. Some people say shut it all down. Some people say can't do that. You'll break the backs of the countries. We could institute a visa system and say, look, you want to come here from any of those countries, you have a passport, you need a visa, you need a 30-day prior approval to come here. You're going to get sick if you have Ebola within the 30 days. There are ways to do this that are a middle ground.
Then in
You
your
can restrict
opinion, why
travel
aren't we
here.
doing this? In your opinion, then why aren't we doing this?
Because I think we're not thinking creatively and outside the box. What's happening
Yes,
is
I'd
we're
like
in
to
the
add
old
to that.
Okay,
spots.
go ahead, Betsy, and add to it.
The CDC has become the Centers for Denial and Confusion. The fact is that they should be proposing exactly what Arthur has suggested, a much more rigorous effort to keep this disease out of the United States.
Then what are we afraid of? Are we afraid of insulting somebody by doing this? What's the problem then?
Well, for me, I think the problem is we're trying to, be sure that we don't break the backs of these countries, but they're tipping over. And I think part of it is old thinking. We want to make sure that we get really creative. I'm going to come back and say again, if every American doesn't know what to do if there's someone from a West African country who's throwing up, has diarrhea near them, they don't know who to call or what to do or which hospital to go to, then CDC isn't doing its job.
Arthur, how frightened are you right now as a medical professional, somebody who understands this? I got a very short amount of time here. How frightened are you right now seeing what's happened in Dallas?
I'm concerned. I'm not panicked. I think we got to push to really get these policies upgraded and moving. The events in Dallas make it clear that that's important, but I'm not freaking out yet. I haven't said I'm not coming into work, and I work at Bellevue, which is the Ebola Central for New York City.
20 seconds, Betsy. It doesn't seem like we're going to be able to do anything quickly here.
Well, look, if one Texan dies, then Frieden should lose his job because he's the one who's allowed this unrestricted travel into this country and at the same time failed to adequately prepare the hospitals to identify and isolate Ebola patients.
And there you go. We're going to have to make that the last word. Good news here and good comment as well. Arthur Caplan, Betsy McCaughey, thank you so much for joining us. We will do this again. All right, later on this hour, forced by the feds to maybe lose a business due to religious beliefs. It's the focus of my commentary and telling it like it is. And after the break, we'll talk to the reporter who broke the Secret Service issue wide open and what it all means when it comes down to not only protecting the president, but protecting the security of Americans here at home. That and so much more coming up right here on Midpoint, where every day we question everything.
President Obama is attending a campaign event with Illinois Governor Pat Quinn today. Later this afternoon, President Obama will be talking about the economy at Northwestern University. And later tonight, the president will be back in Washington, where he'll address the Congressional Hispanic Caucus. This after new numbers from the Department of Homeland Security show that nearly 440,000 people were deported last year. Officials in Texas now say more than 80 people may have come in contact with a man diagnosed with Ebola. Meanwhile, Texas Governor Rick Perry addressed the Ebola outbreak yesterday and says his state is prepared to contain this deadly virus. And nearly 4,000 miles away, another patient will be tested for Ebola. Officials in Hawaii say a man is currently being treated in an isolation unit after showing symptoms of the deadly virus. I'm Olga Villaverde. We'll have another Newsmax Now update coming up at the top of the hour. We hope to see you then.